Heart disease is the #1 cause of death in women. Women can experience risk factors different than men due to stages of life, like pregnancy or menopause.
When we're talking about cardiovascular disease, it doesn't just affect older women, which is what the majority of us sort of think about, that typical woman coming in with a heart attack or heart failure. But pregnancy is a big risk, high-risk time in a woman's life. And so if we have an adverse pregnancy outcome, so things like gestational hypertension or high blood pressure, gestational diabetes, if we have early delivery, if we have eclampsia or preeclampsia, those all increase our future risk of cardiovascular disease.
Some risk factors, like chest pain, shortness of breath, and sweating, are common. Women can also experience atypical symptoms like nausea and fatigue. Maintaining a healthy lifestyle, including diet and exercise, as well as knowing your numbers, are important to lowering the risk of heart disease.
It's important to know your numbers. And what does that mean? Know what your blood pressure is. And really, we say optimal is less than 120/80. We treat it when it gets to 130/80, but really less than 120/80 is where we want to be. Know what your cholesterol is. For LDL cholesterol, or the bad cholesterol, we want that one to be as low as possible. Also, know your waist and your waistline. So a body mass index, and there's tons of calculators online, less than 25 is what we recommend.
At the WVU Heart and Vascular Institute, patients with cardiovascular disease can receive world-class heart care in West Virginia. Services in a variety of fields are offered at the Heart and Vascular Institute to ensure patients receive comprehensive care without having to leave the state.
The WVU Heart and Vascular Institute, I think we've got some really cool things going. We've really been working to put together a team of people who believe in giving you the right care at the right time, at the right place. And so not only do we want you coming to Morgantown if you need to, but we're really working to create a quality network of healthcare teams throughout the state of West Virginia so we can deliver care closer to home. We have experts in most disorders at WVU. We do everything from treating high blood pressure to heart transplant, which is really a full service academic medical center, but we also deliver a lot of care in the community. And so that's really one of my goals in coming to West Virginia, is to help build that regional network so that we can deliver care close to home and then bring people who need to come to Morgantown to Morgantown. We have professionals in heart failure, advanced heart failure, so you can get anything from a diagnosis of heart failure all the way up to a mechanical assist device, like a left ventricular assist device or a heart transplant. And we also do prevention and imaging very well. So we have experts in all forms of cardiac imaging, so we can do the most advanced testing. And then prevention is really what we're working on the most right now.
If you're experiencing chest pains or other symptoms of heart disease, seek medical attention immediately. For the WVU Medicine Health Report, I'm Mary Ravazio Menard.